Hair is often tied closely to a woman's identity. It can be a source of confidence, a reflection of personality, or simply part of daily self-expression. So, when hair starts falling out in unusual amounts, it can be distressing. Hair loss in women is a common yet often overlooked issue that affects millions across the United States. While it's more commonly discussed among men, women experience hair thinning and loss in significant numbers too, and with just as much emotional impact. This article takes an in-depth look at female hair loss, what causes it, how to identify it, and the many options available to help restore not just hair, but confidence. Understanding hair growth and loss. Before diving into the causes of hair loss, it helps to understand how hair grows. Hair goes through a natural cycle of growth, rest, and shedding. 1. Anagen, growth phase. Lasts 2 to 7 years. Around 90% of your hair is in this phase at any time. 2. Catagen, transitional phase. Lasts 2 to 3 weeks. 3. Telogen, resting and shedding phase. Lasts about 3 months. Around 10–15% of hair is in this phase. On a normal day, losing 5,100 hairs is standard. But when hair doesn't grow back fast enough or sheds in larger volumes, thinning and bald spots may appear. Common causes of hair loss in women. 1. Hormonal changes. Hormones play a huge role in hair health. Events like pregnancy, childbirth, menopause, and thyroid imbalances can all impact hair growth. For example, pregnancy. Postpartum. Many women enjoy thicker hair during pregnancy due to rising estrogen levels. But after delivery, hormone levels drop rapidly, leading to postpartum shedding. Menopause. As estrogen and progesterone levels decline, hair may become thinner and more prone to falling out. 2. Genetics. Female pattern hair loss. Also called androgenetic alopecia, this is the most common type of hair loss in women. It typically results in thinning at the crown and along the part, rather than a receding hairline or bald spots like in men. Genetic hair loss is usually gradual and begins after age 40, though it can start earlier. If you have a family history of hair thinning, you're more likely to experience it. 3. Medical conditions. Thyroid disease, hypothyroidism or hyperthyroidism. Polycystic ovary syndrome, PCOS, often leads to increased androgen levels, which may cause male pattern hair loss. Alopecia areata, an autoimmune disorder where the immune system attacks hair follicles, causing patchy loss. Lupus and other autoimmune diseases. Scalp infections, such as ringworm. 4. Nutritional deficiencies. Hair needs adequate nutrients to grow. Common deficiencies linked to hair loss include iron, vitamin D, biotin, zinc, protein, crash. Dieting or eating disorders can also contribute to hair thinning. 5. Stress and trauma. Physical or emotional stress can shock the system, pushing hair into the shedding phase prematurely. This condition is called telogen effluvium and can be triggered by surgery, high fever, major illness, divorce or loss, significant weight loss. Hair usually regrows within 6 to 9 months once the stress resolves. 6. Hairstyles and hair treatments. Excessive styling, heat, chemicals, and tight hairstyles, like braids, ponytails, or weaves, can lead to traction alopecia, hair loss from constant pulling or breakage. Frequent use of flat irons and curling wands, bleaching and coloring, chemical relaxers, hot oil treatments, can damage hair follicles and lead to breakage or even permanent loss if scarring occurs. Types of hair loss in women. There are several forms of hair loss. Here are the most common types. Androgenetic alopecia, genetic and age-related thinning, especially at the crown and along the part. Telogen effluvium, sudden, temporary shedding due to stress or shock. Alopecia areata, patchy hair loss caused by an autoimmune response. Traction. Alopecia, hair loss from tight hairstyles or rough handling. Cicatricial alopecia, scarring alopecia. Inflammatory conditions destroy hair follicles, often leaving scars. Signs and symptoms of hair loss in women. Hair loss in women doesn't usually look like it does in men. Instead of bald patches or receding hairlines, women may notice gradual thinning on top of the head, widening of the part, more hair on the pillow, in the drain, or on your brush, a ponytail that feels thinner, noticeable scalp exposure in certain lighting, hair that breaks more easily. If you experience sudden or patchy hair loss or your hair is falling out in clumps, see a doctor. This may signal a deeper health issue. The emotional impact of hair loss. Hair loss can be deeply personal. For many women, it's tied to femininity, identity, and self-image. Thinning hair can lead to low self-esteem, social anxiety, depression, avoidance of mirrors or photos, strain in relationships. It's important to acknowledge these feelings and seek emotional support alongside treatment. You're not alone, and there are solutions. Diagnosing the cause of hair loss. If you notice hair loss that feels out of the ordinary, consult a healthcare provider or dermatologist. They may ask about your medical history, diet, and stress levels. Examine your scalp. Perform a pull test to see how easily hair comes out. Order blood tests to check thyroid, hormone, and iron levels. Suggest a scalp biopsy if needed. Correct diagnosis is the first step to effective treatment. Treatment options for women's hair loss. The best treatment depends on the cause of your hair loss. Options include 1. Topical medications, minoxidil, Rogaine. FDA approved for women, it can slow hair loss and promote regrowth. It's available over the counter in 2% and 5% strengths. Apply it daily to the scalp. Results take 3-6 months to appear. 2. Prescription medications. Spironolactone, a diuretic that blocks androgens, useful for women with hormonal hair loss. Finasteride, often used in men but occasionally prescribed off-label for postmenopausal women. Oral contraceptives. Birth control pills can balance hormones and help some women with PCOS-related hair loss. 3. Platelet-rich plasma, PRP. Therapy involves drawing your blood, concentrating the platelets, and injecting them into the scalp to stimulate growth. It's a newer, promising option. 4. Hair transplant surgery, suitable for women with permanent genetic hair loss. Involves moving healthy follicles to thinning areas, not typically effective for all types of hair loss. 5. Low-level laser therapy, LLT, uses red light to stimulate hair growth. Available in combs, helmets, and caps for home use. 6. Scalp micropigmentation, cosmetic tattooing that creates the appearance of fuller hair or a buzzed scalp. Natural remedies and lifestyle changes. While medical treatments work well for many, some women prefer natural approaches or want to support their regrowth efforts holistically. Nutrition tips. Eat a balanced diet rich in protein, omega-3s, iron, and zinc. Add hair-supporting vitamins like biotin, vitamin D, and vitamin E. Reduce stress. Practice yoga, meditation, or deep breathing. Take walks or engage in activities you enjoy. Consider talking to a therapist if needed. Be gentle with your hair. Avoid tight hairstyles. Limit heat styling. Use sulfate-free shampoos and conditioners. Pat dry. Don't rub, with a towel. Prevention. Tips for healthy hair. Not all hair loss is preventable, especially genetic types. But you can reduce the risk of some types of hair thinning by avoiding crash diets, taking care of your scalp health, managing stress, not smoking, getting regular checkups for hormonal or thyroid issues. When to see a doctor. Reach out to a healthcare provider if your hair loss is sudden or patchy, your scalp itches, burns, or has sores, you're losing hair rapidly after illness or weight loss, you feel emotionally affected by your hair loss, you suspect a hormone or nutritional issue. Early diagnosis can help prevent further damage. You're not alone, and there's help. Women's hair loss is far more common than most people think. It doesn't mean you've done something wrong, and it certainly doesn't define your beauty or worth. With the right care, it's possible to stop hair loss, regrow hair, or at the very least feel confident again. Whether you choose to treat it medically, cosmetically, or embrace your look naturally, it's your journey, and support is available every step of the way.
Hair loss, also known as alopecia, can happen to just your scalp or your whole body. It may be temporary or permanent, and it can be caused by many different things: genetics, hormones, medical conditions, or simply aging. While anyone can experience hair loss, it's especially common in men. What is baldness? Baldness typically refers to noticeable hair loss from the scalp. The most common cause is hereditary hair loss that happens as we get older. Some people choose to accept it and do nothing, while others might try to cover it up with hats, scarves, or hairstyles. There are also treatments available to slow down hair loss or encourage hair regrowth. Before starting any treatment, it's a good idea to talk to your doctor to understand what's causing your hair loss and what options are right for you. How hair loss looks.
Hair loss can happen in different ways depending on the cause. It may come on suddenly or gradually, and it may affect just your head or your entire body. Common signs include wool, thinning on the top of the head.
This is the most common type of hair loss as people age. In men, it often starts at the hairline. In women, it may start with a widening part or a receding hairline. Patchy or circular bald spots. Some people lose hair in round or uneven patches on the scalp, beard, or eyebrows. These spots may feel itchy or painful before the hair falls out. Sudden hair. Shedding. A big physical or emotional shock can cause hair to loosen. You might notice large amounts of hair coming out when brushing, washing, or even gently tugging. This kind of loss is usually temporary. Full body hair. Loss. Some medical treatments, like chemotherapy, can cause hair to fall out all over your body. In most cases, it grows back over time. Scaly patches on the scalp. This could be caused by a fungal infection like ringworm. You may also notice redness, swelling, broken hairs, or even oozing. When to see a doctor? See your doctor if you're troubled by ongoing hair loss or if your child is experiencing it. For women with a receding hairline, frontal fibrosing alopecia, early treatment is important to avoid permanent hair loss. Also seek help if you notice sudden hair loss, patchy bald spots, or more hair than usual coming out during washing or brushing. Sudden hair loss can sometimes be a sign of an underlying medical issue. Why hair loss happens? It's normal to lose 5,100 hairs a day. Usually, new hair grows in to replace what's lost. Hair loss becomes a problem when that growth cycle is disrupted. Here are the most common causes. Genetics. Hereditary hair loss is the top reason people lose hair. Known as male pattern baldness or female pattern baldness, it usually happens gradually with age. Hormonal changes. Health issues. Hormonal changes due to pregnancy, childbirth, menopause, or thyroid issues can cause hair loss. So can autoimmune conditions like alopecia areata, scalp infections like ringworm, or disorders like trichotillomania, compulsive hair pulling. Medications, supplements. Some drugs used to treat cancer, depression, heart problems, high blood pressure, arthritis, or gout may lead to hair loss. Radiation therapy. Treatment to the head can cause permanent hair loss in the treated area. Stressful events. Physical or emotional trauma can trigger temporary hair shedding a few months later. Hairstyles treatments. Tight hairstyles like braids or ponytails, or frequent use of hot oil treatments and perms can damage hair and cause a type of loss called traction alopecia. If there's scarring, the loss can be permanent. Risk factors. Some things can make hair loss more likely, such as family history of baldness, c. aging, major weight loss, health conditions like diabetes or lupus, high stress levels, poor nutrition. Can hair loss be prevented? Most hair loss from genetics can't be stopped, but there are ways to protect your hair from other causes of damage. Be gentle with your hair. Avoid tugging, especially when it's wet. Use a wide-tooth comb and try not to pull or twist your hair tightly. Avoid harsh styling tools and treatments, like hot rollers, curling irons, perms, and hot oil treatments. Limit tight hairstyles like braids, ponytails, and buns that pull on your scalp. Check with your doctor if you think any medications or supplements you're taking may be causing hair loss. Protect your hair from sun damage. If you're undergoing chemotherapy, ask your doctor about wearing a cooling cap to help reduce hair loss. Stop smoking. Some research suggests smoking may be linked to hair loss in men. If you're experiencing hair loss, you're not alone, and you have options, whether you decide to treat it, hide it, or embrace it. Understanding the cause is the first step. A conversation with your doctor can help you figure out what's right for you.